Assalamu alaikum wa rahmatullahi wa barakatuh. A very warm welcome to the new health show here on Hilaal TV. I'm Khawa Solomon. Stay with me for the next hour as we inform you about post-COVID protocols. Yes, we've been told to not wear masks. There are still people wearing masks. There are fears around that. And then also what's happening after COVID. Where is our health situation at? Where is our health system situation at? And what's happening, whether it's private or public sector? We'll be informing you about that all in this show today. We'll be also chatting to Dr. Shuaib Wadi, representative of the IMA, giving us some information around the IMA, and also somebody joining us from the public health sector. Stay tuned. For now, we chat to Dr. Nasif van der Skeef, who is at Victoria Hospital, specialist physician, heading the department out there, and he is online with us right now. So let's connect with Dr. Nasif. Assalamu alaikum to you, Dr. Nasif van der Skeef. How are you doing, sir?
Wa alaikum assalam wa rahmatullahi wa barakatuh, Khawa, and salams to you and the listeners.
Great. I'm very excited as we start our first health show off with a bleak but happy situation where we are right now post-COVID. Last time I was on air with a health show, it was hard lockdown. It was doctors, hospitals being inundated, and it was quite scary. For you guys on the other side. Yes, we were at home, we were trying to protect ourselves and do the necessary. But now, alhamdulillah, we're in a situation, I didn't think we would find ourselves here, but we are, shukr alhamdulillah, post-COVID. I think to start us off, Dr. Nasif, we need to look at, what has happened and how people were affected and how they are living post-COVID right now. So from your side, what can we sort of look at as far as the impact of COVID, how that affected people, the hospitals, the environments, and especially patients who needed the necessary care during the COVID hard lockdown, and even when there was the regulations had eased, how people were taking care of themselves. So can we look at the past 2 years? What was the environment like, and where are the hospital situation now?
Yes, Khawa. So I think it's important to remember that during the hard lockdown, during the COVID period, the services was severely diminished. Only essential services and emergencies was catered for, and our focus was very much geared around COVID. And the net result of that was there was a massive de-escalation of services, whether it's outpatient services, whether it was surgeries, and pretty much and that happened at various levels. That happened in the hospitals, that happened at the primary healthcare facilities, and I think getting to see a doctor during this period for anything that wasn't COVID related was very difficult, and pretty much only emergencies was attended to. And now we getting to sort of pay the price for that. We're getting to pay the price for not having good healthcare over the last 2 years. And that impact has certainly been seen in the hospitals, Khawa.
All right. So what does that actually mean? Are we talking about on a general basis with regards to patients? Are we talking about patients who are who have like chronic conditions? Because of course, being inundated with COVID situations, the hospital needed to deal with that at that time. So let's look at. I even heard that elective surgeries were put on hold. So let's try and understand what specifics are you referring to with these conditions. Was it chronic conditions, or was it actually people, on a day-to-day basis just checking their sugar levels, their high blood pressure and stuff?
Yeah, Khawa, it was definitely, number one, from a medical point of view, it was lots of people with chronic conditions. And yeah, I'm referring to people with hypertension, people with diabetes, people with lung conditions such as asthma or emphysema. For these chronic conditions, what is required is on a regular basis for these patients to be seen by the healthcare provider, for these patients to receive counseling, for these patients to have regular checkups, for these patients to take their medication, so that these conditions are well managed chronically. Unfortunately, for many of these patients, that simply did not happen to the level that it needed to happen. And then there were certain conditions such as effective screening that needed to happen, screening for types of cancers, etc. And that also was de-escalated. And then there was possibly surgeries, people needing sort of not urgent surgeries, but sort of semi-urgent or semi-elective surgeries. For I'm thinking of, for example, gallbladder surgery, hernia surgeries, for example. And these surgeries, unfortunately, just couldn't happen during the COVID period because COVID had just taken over our hospitals. So what we're seeing now is that through not performing those operations, through people not having those regular checkups, these conditions have now severely flared up.
Okay, so was it just because COVID was at the hospitals? Were the reasons why that they were too scared to go to the hospitals, or was it that you guys were just inundated and not being able to help them? What was the situation, or were they just fearing that, you know what, I'm okay? My blood pressure, I think, is okay. Maybe they monitored at home, took their sugar levels at home. What were the main reasons you said you could think of that why they stayed away?
I'll say that there's not one reason for this. I think it's a multifactorial reasons why it occurred. Certainly from the health point of view, many GP surgeries and many primary healthcare just wasn't available. The focus was pretty much on managing COVID and managing emergencies. I can certainly say that in the hospital where I work, in many hospitals, there was a severe de-escalation of services. So, for example, our outpatients department, the numbers were severely reduced. The hospital did not offer many of the elective surgeries during the COVID period. And also our focus was very much around managing COVID. But also, we also needed to reduce foot traffic to the hospital because one of the issues of COVID was around infection control. So what you didn't want was someone coming for one reason, whether that's the hypertension, coming for the surgery, and then leaving with COVID. So we needed to certainly reduce the foot traffic to the hospital, and whether it was a Victoria hospital or any other hospital, but also at the primary healthcare facilities. The net result of that was that there's many of these chronic conditions that our community suffers from. Your hypertension, your diabetes, your asthma. Many of these conditions were not well looked after during the last probably 1 to 2 year period, and now is suffering from these conditions not being well managed. You have someone with, for example, with diabetes, and for the last 2 years they've just taken the medication, and perhaps the diabetes hasn't been well controlled. We've had people with hypertension. They haven't had proper blood pressure checks for about 2 years. And now we're seeing the impact of poor blood pressure control, whether it's in the heart, whether it's in the kidneys, etc., of those conditions. We've seen people that have poorly controlled asthma. They've perhaps taken the medication, and now they're being admitted with quite a severe relapse of these conditions, where people are now admitted to hospital as a consequence of the complications of these chronic conditions not being well controlled. Also what we've seen is that because there hasn't been the interaction with the healthcare service, patients with the doctors, etc., several patients have unfortunately stopped taking the medication altogether. So we've seen a large amount of patients that have defaulted the medication. And because they've defaulted the medication, their health has now suffered a consequence. In terms of operations, etc., we've now seen an escalation of cancers, colonic cancers, breast cancers, stomach cancers, where perhaps over the last 2 years, having very effective screening would have picked up these cancers early on where they can be cured. Now, some cancers are now coming at an advanced stage of where perhaps now it's not curative, now it's palliative. So those are some of the impacts that has happened, as a consequence of the de-escalation of health services during the COVID period.
So how is the hospital dealing with this right now? And I think in the same breath, what do you need to tell patients and people that might not have a history of hypertension, of sugar, but they know that or even cancers, they have it in their family and haven't gone for the necessary screening or health checks? What do you need to tell them now? But firstly, let's just check in how hospitals are doing with regards to dealing with all of that you just mentioned, the illnesses now.
So what I can tell you is that, especially over the last several months, I would say even almost the entire year, And I'm a specialist physician, and my department, the medicine department, has been flooded in with a large number of patients that have just been admitted with poor health, with heart failure, with kidney failure, with poorly controlled hypertension, with poorly controlled diabetes, with multiple respiratory complaints, etc. So the hospital, our medical wards are being flooded in. We have medical patients in surgical wards and all over the hospital. So the number of people being admitted to hospital has massively spiked. I'd say it's been over the entire year. And especially now into the winter season, where various respiratory problems have now flared up, the usual colds, the usual flus, the other viruses that we normally see. These conditions have also now resulted in people with poorly controlled asthma, poorly controlled emphysema, them requiring admission to hospital. So certainly the numbers have massively escalated, and it's been going on now for several months. But also from the surgeries, from the cancers, as I've said earlier, various people are now being diagnosed with cancers where perhaps if it was early detected, the treatment would have been that much different.
Okay. We're going to take a short break. When we come back, we continue our conversation with Dr. Nasif van der Schijf, specialist physician, also the head of Department of Internal Medicine at Victoria Hospital. Stay with us. More on health and wellness. Assalamu alaikum, a very good day to you. Welcome back. This is the Health and Wellness Show. I'm Khawa Solomon, and we're about three-quarter way through, so stay with us as we talk post-COVID. Online, we have Dr. Nasif van der Schijf, a specialist physician out of the Victoria Hospital and head of the Department of Internal Medicine. Assalamu alaikum, and welcome back, Dr. Nasif.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
So just before the show, it was quite frightening to hear that the is so much going on at hospitals still, and to understand that people didn't necessarily take their own health into consideration during COVID. I think, just because you've stated a few facts with regards to people and their chronic illnesses, people also with some of the semi-elective surgeries, some of their health conditions that they might not feel that they need to go and see a doctor. What is the sort of follow-up and protocol? Is it going to see someone at the hospital or popping in at your GP just to do a checkup first? And also, what advice do you give now, seeing that, and this has been also a pretty cold winter for us here in Johannesburg. I believe Cape Town has also been quite cold. But just to follow up on some of the niggles with people having conditions that they need to follow up on, what is your advice to that?
I think that, firstly, I think people need to have a greater sense of health awareness regarding their health. I think that a really good checkup, I think, is in order. For the last 2 years, unfortunately, we haven't had that. We haven't had the privilege of being able to go to your doctor, to be able to go for a checkup. So whether you have a medical condition such as hypertension, such as diabetes, such as asthma, it's important to go and check that out. Perhaps the control is not so good anymore. Perhaps the medication has to be adjusted. Perhaps there's been a complication that has developed that you're completely unaware of. If you have hypertension, perhaps you need to go for an ECG, perhaps you need to go and check out your kidneys. That hasn't happened possibly for the last 2 years. So it's not good enough just to take the medication and hope for the best. So number one, I think, being aware of one's health and having a desire to try to improve one's health. That I'd say would be the first step that everyone needs to do, right? And that making that appointment, whether it is at your GP or whether it is at your primary healthcare facility, it's important that happens sooner rather than later. Okay. The next thing I'd say, Khawa, is that many of us have medical conditions in the family that puts us at risk. So many people have not had proper medical screening for the last 2 years.
Okay.
There may be a history of cancer in the family. For example, breast cancer, or it could be colon cancer, or it could be a history of hypertension or diabetes for that matter. Now, part of good health and well-being is going to screen for those. Perhaps in the last 2 years, where you haven't been to the doctor, where you haven't had a checkup, where you haven't checked your blood pressure, your cholesterol, or your sugar, perhaps now 2 years later is the time to go for the checkup. because you may have been at risk before COVID, but it's possible that during this COVID period, you've now developed those conditions. But you'll only know if you go and find out and you have yourself checked up. So screening, I think, Hawa, is very important.
Okay. Let's talk around, the wearing of masks, just to touch on that quickly, because this is an understanding now that it's, alhamdulillah, it's okay that we don't need to wear masks anymore. But coming to some outlets and even at some medical practices, and I think even at the hospitals, we find that people are still wearing masks. Could you take us around some of the fears and the concerns of people that actually still worry about the fact that they're not wearing the mask? Would that, impact their respiratory conditions, that they maybe picked up a flu or a virus now? Because I've also had some questions around viruses that not necessarily COVID, but it's been quite bad and people's been hit, like literally for a week or two they'd be down.
So Khawa, we need to remember that the masks are an effective measure to reduce the transmission of any respiratory illness. We know that COVID, a lot of our understanding regarding how COVID is transmitted has changed progressively over the last 2 years during the COVID period. We now know that the highest risk of picking up COVID, or actual fact, probably any respiratory infection such as influenza virus, the common cold, rhinovirus, adenovirus, some of these are the common viruses that we tend to see, that these viruses are, the risk of transmission is greatest in an indoor area with poor ventilation. Okay. So if you're going to go into a confined area where there's lots of people, and if there are people in that area, in that room or that house, etc., where they are sick, the risk of picking up that respiratory infection is significantly elevated. So we now know that wearing a mask in an indoor confined area significantly lowers the risk of contracting COVID or any other virus.
But also wearing that mask. Somebody mentioned to me, also we need to realize that we're not just wearing a mask, we need to wear it properly if we're going to be wearing the mask to really protect ourselves.
Obviously, you have to wear the mask properly. You should cover your nose, should cover your mouth, right? It needs to be properly adhered, etc. Mustn't be moist. So obviously, I think we've all learned around wearing mask and essentially it has to be a clean mask. But we also know, however, that the risk of picking up COVID or any other respiratory virus is significantly diminished outdoors. Okay. Outdoors, in the open, in well-ventilated areas, that risk is significantly reduced. Now, you would have seen that if you've been to a hospital, that in the hospital, the mask wearing is in many hospitals, including my hospital, we are still wearing masks and we see it as part of PPE. So because we are still encountering COVID patients, we're still encountering patients with flu virus and other types of viruses and infections. And we still at risk as healthcare workers. Yeah. So certainly in the hospital, we are still wearing masks. And we even change our mask if we are going to an area where we think there is tuberculosis, we wear a different type of mask called an N95 mask.
Okay, let's talk about schools and children and the current situation, because it's quite a bite. Alhamdulillah, it's getting a little bit warm now. Not really, but we're looking forward to a beautiful spring, inshallah. This winter has been colder than other winters. People have been affected, or at least I talk from myself as well. I had a virus. I'm not sure if it was a flu, but I was down 2 weeks. So let's just quickly understand where our current immune system is right now after wearing masks on and off for 2 years now. What do we need to know as laymen that are just getting the common cold or a flu? Because I don't think I've had a flu that will knock me out for 2 weeks. But this was quite bad. I thought I actually had COVID. So let's talk about that situation, using that as an example. Why was it so long? Why did it take me that long to recover? I did have a little bit of long COVID after I had COVID. Somebody explained it to me that it's almost like a long COVID, so your body takes a little bit longer. Is this going to be happening now for the next couple of years when you do get sick with common cold or flu?
How not necessarily. I mean, how you recover from any viral infection, whether it is flu, whether it is COVID, etc. It's dependent upon your health and your own immunity, and
Okay.
that is clearly different from person to person. I almost feel that for the last 2 years, not only haven't we gone for health checks, we haven't gone to, like I said earlier, to GPs, or we haven't perhaps looked after ourselves from a health point of view. I don't think people have perhaps been living as healthy as what they could have. By that I mean exercise. I mean eating healthy and exercise, which is an important part of one's health and well-being. So it may be that people's health have possibly deteriorated, because they haven't been living very healthy for the last 2 years. So that's the first point. And if one doesn't live very healthy, you don't eat properly, you don't exercise, your risk of picking up infections is significantly increased. And also, when you get sick, the chances are very strong that you may take longer to get better. That's the first thing. Second thing is that I'm not sure. Certainly, my my feeling is that perhaps not many people this year had the influenza virus vaccine, compared to before COVID, whereby you knew that, February or March of every year, you have to go for the annual flu vaccine.
Yeah.
Certainly, my perception, and this is also what I've seen in the hospital, is that many people have not had the influenza vaccine. So the chances are that, the uptake of vaccine for the flu vaccine this year has been low, and possibly many people have picked up the flu as a consequence. So my recommendation would be the usual advice as we always recommend. Number one, make sure that you exercise regularly. Make sure that you watch your diet, you eat healthily, you eat lots of fruit and vegetables. Make sure that you get adequate sleep. That the importance of sleep, I can tell you, especially for revitalizing one's body, for the strength of your immunity, sleep is very important.
Okay.
Make sure you drink, enough fluids, to your thirst, etc. And those basic things are very important. Make sure that you manage your stress well, because we know that if you're very stressed out, your immunity also drops. And then having regular checkups, especially if you're at risk for certain conditions that I spoke about earlier. And then as it relates to your vaccinations, whether it's a flu vaccine, going sure that you're going for those vaccines. Some people may require additional vaccinations, such as the pneumococcal vaccine, if they have underlying respiratory conditions.
Okay.
So chat to the doctor, say perhaps you need to go for one of those vaccines. And then if you are sick, ensuring that you seek healthcare quickly and timelessly, so that appropriate treatment can be given quickly and timelessly.
Great stuff. Dr. Nasif van der Schyff, unfortunately, that's where we have to leave it. Shukran, jazakallah so much for your time. All the best and keep going. And thank you to you and your staff, the nurses as well, and everybody at the hospital who's done some brilliant work over this past 2 years and still going strong. We appreciate your time. Assalamu alaikum.
Shukran. Wa alaikum salam.
That was Dr. Nasif van der Schyff, based out at the Victoria Hospital, Western Cape Town, Head of Internal Medicine at the Victoria Hospital, as well as Senior Lecturer at the University of Cape Town, UCT. Shukran so much to him. And next up, we chat to someone in the public health sector. Stay tuned. Assalamu alaikum and a very good day to you. Welcome back to Health and Wellness. I'm Hawa Solomon. Stay with us. We've still got our last two segments as we talk about post-COVID. And this will be a series of talks on post-COVID. What's happening with your health? Where is your health at? Not just your health, but your wellness. This show will deal with the holistic approach of you. So now we'll be chatting to somebody from public health and government, and we say a very good day to Dr. Malachi, and she is from the Limpopo province, heading a public health medicine specialist in the Department of Health in Limpopo. Thank you so much for joining us, ma'am.
Thank you.
So you were leading the surveillance system and COVID-19 vaccination program in the Limpopo province during the pandemic. If you could just briefly talk to us about that and where Limpopo province is right now.
Okay, since the COVID response started, I was overseeing the unit that takes care of the data that tells us what is happening with COVID-19 in the province. So you will know that currently where we are as a country and as a province, we've been through 5 waves, and the most recent was is much smaller than the previous waves that we had before, and we had much less mortality and much less morbidity, and meaning like hospitalizations from COVID-19. And since that wave that we've had persistently very low numbers of COVID-19 in the province and in most of the provinces in the country.
Thank you, Doc, for that. I appreciate it. If you can give us a brief on looking at government and public health, what was the main reasons why the masks is not compulsory anymore, and where is public health at the moment with wearing masks? And if there are people still wanting to wear masks, what are the guidelines?
Okay. There are 2 sort of main groups of approaches when looking at why there was a repeal in the COVID-19 regulations. On the one side, we're looking at the health system and the statistics that are showing us that there are less reported cases of COVID-19, and then we had less number of deaths that were reported, and less number of hospitalizations. And then in addition to that, we have seen that the health system itself has developed a capacity to respond to COVID-19 in terms of being able to manage the cases that present to our hospitals and to our primary healthcare facilities. So that is the one side. But on the other side, I think what is important for the country, or the decision that was being made, is to balance the economy on the one side and also the health system on the other side. So we know that COVID has had a negative impact on the economy, and as part of recovery of the economy in the country, it was important that some of those regulations had to be repealed. And one of those regulations was actually the wearing of masks. But we know that also regulations around gatherings, and then regulations around the control or at our border post were also repealed as well. If you want me to talk specifically about the wearing of the masks, we first have to understand the reason why the mask was actually introduced. There are 2 main things. The one being that for somebody who's coughing or who's having respiratory symptoms, wearing a mask protects other people, because then they will not be able to spread the risk of spreading the virus or any bacteria is then limited by that barrier that the mask is providing. That's one side. And then on the other side, for other people that are wearing masks as well, it means that you're reducing your own risk, because the risk of inhaling particles that are infected with the virus, maybe COVID-19 or any other infectious agent, are reduced when you're wearing a mask. So that was the reason why it was initially recommended. But however, you'll appreciate that where we are in the COVID response and having matured after 2 years of responding, the situation is not the same as it was. On the one side, there's a vaccination program that has been introduced that is very robust, and there's access to vaccines within the country. And we know that these vaccines are effective and they can protect people from hospitalization. So that was one reason as well to say why mask must be not compulsory anymore. And then secondly, the other reason why masks are not compulsory is that we know that there's been a lot of medical waste that has been created. This is one negative impact regarding the wearing of masks, especially surgical masks. So the negative impact of the waste that has been generated for some of the masks is also an important consideration. And then in terms of the cloth mask as well, we know that a lot of people do not wear masks appropriately. First, it must be an appropriate mask, which is a 3-layered mask, a cloth mask that will be able to protect you. And the second time, you must wear it consistently, and you must wear it such that it covers your mouth and it covers your nose. Yes. So if you're not wearing it appropriately, it may not be as effective as it's supposed to be. We know that in a lot of areas, there were a lot of people who were not adherent with the wearing of masks. So I think those are some of the reasons behind broadly the repeal of the regulations, and then secondly, the one in particular dealing with the wearing of masks.
Dr. Tumi, give us some guidelines on, now that masks are not compulsory anymore, we don't have to wear them. How can we still protect ourselves even though we're not wearing masks? And especially, with the respiratory conditions, it's quite cold. People are suffering quite a bit with the common cold and flu a little bit longer than they usually do. Just give us some guidelines around that, and also the realization of TB, at high stats in South Africa.
Yeah. So as health as well, we are moving away from just looking at the prevention of COVID-19, but shifting towards a more comprehensive approach in terms of the prevention of infectious diseases at community level. So what we are saying is that in terms of the wearing of masks, there are certain circumstances wherein we recommend that people can still wear masks. And this is in particular when you are in an indoor setting where there's no good ventilation and where it's actually overcrowded as well, because we know that in those settings, the risk of transmission is higher. And then we still recommend that for those vulnerable groups and people with comorbidities, and we're also looking at pregnant women and lactating women that may be at a higher risk of severe disease from COVID. We still recommend that they can protect themselves by actually wearing masks. And then thirdly, lastly, those people that have respiratory symptoms that are coughing. It could be due to an influenza, it could be due to TB, it could be to any other infection causing respiratory symptoms. Then we do recommend that they will continue to wear a mask so that they can protect other people. So that, as you cough, you spread your particles much wider and you increase the risk of transmission to other people. So it will still be recommended for those people to wear masks. So yeah, those are the recommendations around wearing masks for individual protection.
Let's look at the other flip side of the, going outside, attending schools, classes, and other events. If you come to a venue or a place of work or crowded areas and people are wearing your mask, what is your rights? Your legal rights, and also how can you then protect yourself and find, and I think actually the real question is, why are they asking you to wear their mask or to sanitize?
Can you say that question again?
Sorry, the line is a bit bad. Sorry about that. Can people and businesses still decide to wear masks in their workplaces and in other areas? And if people are visiting, if they have customers or others visiting, can they still ask them to sanitize or to wear a mask, visiting outdoor areas or going to these places of business?
Yeah. Well, I think the regulations themselves do state that they allow entities, which can be businesses, it can be churches, to make their own rules around, or guidelines around how to prevent transmission of diseases within that context or that entity. Or I'll give an example of a church. It can be able to give its own regulations. So I think the church itself has to look, let's say, for example, it's a church. I'll use that as an example, but it could be a business entity. It has to look at its own risk of transmission and, the number of people that are attending perhaps their sessions or a meeting, and then from there apply measures. But what we are recommending, based on what we have learned through the COVID response, is that some of the things that we have learned through COVID, we still have to maintain to reduce transmission of diseases. For example, we are saying that we know that good ventilation has always been a very good practice for prevention of transmission. So you must ensure that all your windows and your doors are open as much as possible when you have people meeting in an indoor setting to reduce transmission, as I've already said. And then secondly, where possible, where you're having a large number of people gathering, you do prefer to have it outdoors rather than indoors, where people are crowded and perhaps that could be conducive to transmission. So we do recommend that it should actually be done outdoors. And in terms of hand hygiene or sanitizing your hand, I think this is still a very good practice, because we know that the hands are the ones that actually transmit infection from one area to another or from one person to another. So keeping our hands clean not only protects for respiratory infections, but also protect from other infections that can cause, GIT symptoms such as diarrhea, etc. And I think this is a practice that we've been doing through COVID, but we should actually maintain in a majority of the places that we are entering. and protecting, encouraging people to vaccinate as one of the main strategies to assist people to be able to be immune to COVID-19 remains important as well. Meaning that, if you're running a business, you have your employees, you would encourage your employees to go for vaccination and perhaps have a booster vaccine at least once every 6 months. And those that are vulnerable, older with comorbidities, we recommend that they have even more frequent boosters as per national guideline currently encourages. So in brief, those are some of the measures that you can put in place. But you have to also remember that some of these measures of what we call cough etiquette, or sometimes call it cough protocol, meaning that when you cough, you should cough into your armpit, and then when you are done, you should wash your hands so that those bacteria, you're not spreading them to other surfaces and to other people. And that when you cough or you sneeze, I think that should still be something that also should be emphasized, because it will help in reducing the spread of influenza, for example, and TB.
Thank you so much, Dr. Tumi Malachi. We appreciate your time, public health medicine specialist for the Limpopo Department of Health. We appreciate your time. All the best till we chat again. Goodbye for now.
Thank you very much.
You. That was Dr. Tumi Malachi, public health medicine specialist for the Limpopo Department of Health. Next up, we speak to Dr. Shuaib Wadi, and he will represent the Islamic Medical Association of South Africa. Please do stay with us. Assalamu alaikum, a very good day. Welcome back to Health and Wellness. I'm Hawa Solomon. Our topic of discussion is post-COVID. Now we, alhamdulillah, will be chatting to Dr. Shuaib Wadi, who is a representative of the Islamic Medical Association, to find out where they are at, inshallah. Assalamu alaikum to you, Doc, and how are you doing?
Wa alaikum salam wa rahmatullahi wa barakatuh. I am well, shukr. Alhamdulillah.
Alhamdulillah. Good to speak to you. So glad you're available to be on our first health and wellness show for today. Now, quickly, let's get into the topic. It's been a very interesting one today, post-COVID, chatting to a specialist physician, Dr. Nasif van der Skeef, out at the Victoria Hospital, as well as Dr. Tumi, who is out at Limpopo Health, just giving us an update also where they are post-COVID. With regards to the IMA, please give us an update after 2 years of a very, very busy, tiring, blood, sweat and tears, and lots of loss as well. Dr. Wadi, where is the IMA and the current situation with the doctors at now, inshallah?
So, as you know, the COVID affected every facet of society, and that included the IMA's activities over the past 2 years. So a lot of the activities that the IMA was doing over the past several years were sort of suspended and had to come partially to stop to focus some areas on COVID relief and assisting people with COVID, and sort of tooling up the community for COVID. So that included, for example, in Gauteng, one of our community clinics closed because it was difficult for patients to get into there because of COVID, and it wasn't sort of practical to continue that service. Our staff there was very old and they couldn't manage to be in a high-risk setting anymore. Some of our screening programs obviously came to a stop. We couldn't do all of that. But many of the other projects continued. So the Durban clinics, for example, they continued to soldier on. They retooled. They did different things. Our partnership with the Muslim AIDS program continued, and the MAP is in the process of rediscovering itself and around prevention of healthcare problems in general, not just around HIV, but also around TB, other social problems, and other infectious diseases. And then we obviously continued with our renal dialysis program in Durban and around the country. Those patients obviously are dependent on dialysis. But as you can imagine, a lot of funds that would normally be directed to some of these programs were directed towards COVID projects. And during the pandemic, we partnered with multiple different organizations in multiple different ways, whether it was relief, whether it was advice for the community, whether it was providing PPE and masks and so forth and so on. So I think Obviously, now that the influence of COVID has diminished and we're returning to normality, we have to get some of those programs kickstarted. So the oxygen program, for example, in many different areas, those machines were donated to individuals or to public hospitals, and that was a huge focus during COVID for the IMA. But now, obviously, the need for those things are much reduced. So we focus back on some of the things which have always been there. Obviously, poverty-related infectious diseases, lack of access to primary health care, lack of screening, assisting people in old age homes, assisting young children with eye screening and spectacles. And then obviously the dialysis programs, the IMA hospital and our involvement in that. So we're moving back towards normality. Obviously, COVID is not gone. It's just has much less of an influence proportionate to other diseases than it did during that period.
So with regards to the people that had, of course, known about the various programs and activities, I know that there's more activities now, and somewhat, not completely, but somewhat normalization of some of the activities. What do people need to know about, the regular updates that the IMA used to have? How can they still get in contact with the programs and the workshops or the initiations that the IMA are involved in?
So, I mean, one of the big things for the IMA from the medical practitioner side was continuing medical education, and particularly our conference. So after 2 years, in fact, I think it's 3 years, we're having our conference again in Durban this year, inshallah. And that will afford us an opportunity to get together and also strategically plan how the IMA moves forward, inshallah. And also, I mean, that conference covers a lot of the issues around ethical Islamic issues that we need to be cognizant of as medical doctors. So if there are medical personnel who are listening, I would encourage them to get involved and come through. At the local branch, that's the big national project that's happening in the next couple of months, obviously. At the local branch
that'll be in Durban, Dr. Wadi?
That'll be in Durban.
Yeah,
that'll be in Durban. So that's on the 1st and 2nd of October. So at the local branch level, obviously lots of activities happen. Many of the branches have changed personnel substantially. In Durban, we're looking at setting up a frail care center using our Baitul Nur arm. And obviously our dialysis program continues. There are other projects in Gauteng. We've reinitiated our screening programs. So I think if you go onto the website, you should see information about upcoming events. You can also follow our Instagram, Twitter, and Facebook pages, which I don't know about Twitter, but Facebook pages, which give information about upcoming activities which the organization is going to be involved in, and also highlights activities which have taken place as well. So I think social media and the website is a good place to start. We used to have, and we should publish one soon, something called a BIMA, which was a bulletin of the IMA, which gave some more information about activities which are going on and how to get involved with your branch and how to engage the IMA if you need it. So inshallah, I think those things are sort of being rolled out over the next couple of months again as we return back to sort of the normal functionality of the organization.
Inshallah. And then with regards to medical and wellness concerns and sort of a holistic approach of people being better mentally after COVID-19, what is your concerns right now, and what is also your advice for those individuals who have still fears around COVID from the IMA, of course?
So as I mentioned, COVID is here to stay as a disease, just like the flu, just like other viral infections. And it won't be the first disease which has erupted in our lifetime and has changed the face of medical practice. If you look at HIV, in the 80s, changed the face of medical practice, and particularly changed, some would say, the entire future of South Africa because of how badly we were affected. I mean, putting aside various theories about where or how COVID came about, obviously we left with a situation where we have to deal with what's in front of us now. At present, governments around the world have embarked on mass vaccination drives to try and vaccinate the majority of the population to reduce hospitalizations and admissions and deaths from COVID-19. And I think together with the multiple waves that we've had and people developing natural immunity to COVID, the risk of hospitalization and death has reduced substantially. That does not to say that there aren't COVID patients admitted with pneumonia in hospital. There are. But it's not what it was sort of 1 year ago, exactly 1 year this time, where hospitals were full of patients who had predominantly COVID, and there was no space for really anybody else. Since the COVID epidemic, obviously, we've had mini epidemics of other respiratory conditions because people obviously were not sort of exposed to them in a big way because of isolation, because of masking and so forth in the last 2 years. So we had a sort of rebound of RSV, influenza, parainfluenza. We had a swine flu, so influenza H1N1 outbreak. And many patients were admitted with those respiratory infections. So, and some patients died of those respiratory infections as well. So I think there are these viral respiratory infections and bacterial respiratory infections are there. COVID now forms one of many that we need to be cognizant of, and some have specific treatments, some are treated supportively, and that's where we are at the moment with these conditions. In terms of taking precautions, if you want to mask up, I mean, I think you should mask up. There's nothing to stop you from doing it. In terms of protecting yourself, that means if you're in a crowded area and you want to protect yourself, you should use a proper medical mask. A cloth mask is not going to protect you. If we want to have widespread community protection, then everybody should be masking. But I think we are past that stage now, and it's not necessary anymore. But if you want to have individual protection, maybe you are at higher risk, or you're living with somebody at higher risk. And we've learned some of these lessons over the past 2 years with COVID, things that were probably always there in terms of respiratory viral infections, but COVID has sort of brought to the fore. Is that if you want to protect yourself, then maybe you should use a proper medical mask which is fitted properly, and that can help to protect you to some degree from getting a viral infection over time.
Always a pleasure having you online with us, Dr. Shuaib Wadi. Your final comments as we wrap up today's post-COVID show. We'll be following up with some more shows post-COVID with regards to the common conditions that there are some concerns, especially the respiratory ones, those that hadn't had the necessary checkups for their sugars and high blood pressure. What is your message to those individuals?
So just specifically about high blood pressure, diabetes, and chronic diseases. So there's evidence, epidemiological evidence that COVID, I'm not sure whether it's specific to COVID or it's just related to the viral infections, has increased the number of diabetics in the community. It may be that we were using high doses of steroids for these patients. It may be COVID itself was affecting the pancreas or other organs, or changing the way your insulin sensitivity works. But epidemiologically, there certainly seems to be an uptick in the number of diabetics. Okay. It also may be that many diabetics who are undiagnosed have come to the fore because they were sick from COVID. So I think many people have not paid close attention to the chronic conditions like hypertension, diabetes, asthma, chronic kidney disease, and many others. And if they haven't had a regular checkup with their primary physician or their specialist, they should consider doing that, because we've seen significant deteriorations in function and in control of many of these patients because of the sort of lack of the change in the social structure of our communities over the last 3 years.
Dr. Shuaib Wadi, a representative for the IMA-SA, please follow the various social pages for updates, and also now them going back on track with their usual activities and workshop. Always a pleasure, Dr. Wadi. Till we chat again, Assalamu alaikum.
Wa alaikum salam wa
rahmatullahi wa barakatuh. That was Dr. Shuaib Wadi, nephrologist and representative for the Islamic Medical Association for Southern Africa. We will have the details on screen as well as on our website as well, if you'd like to get hold of them and follow the various medical workshops. We say a big shukran to all our guests today. Stay tuned for our next show as we chat more respiratory conditions post-COVID. Health and wellness. Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye from myself.